All right, Amelia, I am really excited today because we get to talk to Emily Hartley, who is the new executive director for the Missouri Developmental Disabilities Council. And Emily, welcome to Accessible.
Thank you. Thank you for having me. I appreciate the invitation.
Oh, we're really excited, and um, I was going to maybe welcome you to the DD network, but you've been involved in the DD Council for a while, so I don't have to do that. But definitely would love to hear more about how you got into this field.
Yeah, sure. So in college, I went to college across the river in Illinois at SIUE. And I was a psychology major in college. And one of my summers in college, I kind of spontaneously signed up to work at a summer camp in New York, even though I had never been out of the state or on an airplane, alone by myself. But I went to New York, and it was for a summer camp for at-risk children, because I always thought I would kind of end up in social services, like working with kids in need, like foster care systems kind of work. And when I got there, I ended up connecting really well with the summer camp participants that had disabilities. And so that usually looked like a youngster with autism. So we're talking about tween age, like 13 to 14-year-olds. And they came from all across the state in New York. And so I had no context for them or their families or the services that New York offered or any of that. So when I came back to college in Illinois, I really did a focus in my college education on disability study to better understand autism, to better understand services for people with disabilities, and just to better understand disability history in general.
And they offered those classes at your college?
They did, yeah. So we had a professor that was a daughter of I can't remember her name right now, but he was really instrumental in understanding autism in the really early ages. So I remember that course. It really burned an image in my mind of kids, in cribs left unattended. You're talking about multiple young kids in cribs left unattended, engaging in self-harm and being staffed by these, medical personnel. And that was a lot about the history of autism in the coursework that I took.
Mm-hmm. Wow. And what school was that? That was Eastern Illinois?
It was Edwardsville, Southern Illinois and
Edwardsville,
Edwardsville.
Southern. Oh, awesome. Great. Well, cool. So then you graduated from SIU and came back to St. Louis or Missouri, or what was the progression?
Yeah, so when I got back from New York, I changed my coursework to really focus on disabilities. And then I took a job with what was at the time Judavine Center for Autism in St. Louis.
Mm-hmm.
And they were kind of a statewide national expert on autism. But they also had a really intense and really dynamic training for staff at Judavine Center. So when I started at Judavine, I was invested 3 weeks of training, and which was embedded with families and kids with disabilities, specifically autism, and I was learning with them throughout the process. So I started working there just kind of part-time in respite services. I had a family in St. Louis that I would come and work with when I wasn't working in school. And through that uh, organization, I was able to grow professionally, and I stayed with that organization, which eventually ended up being Easter Seals Midwest. I stayed with them for about 17 years, working in different provider realms.
Wow.
Yeah.
Emily, how did you then end up at the DD Council? Were you just recruited by the former director, Vicky, or how did you end up into our DD network?
Yeah. So when HCBS, Home and Community-Based Services, became a big focus, I was working in day programs for Easter Seals at the time, and we were kind of going through just systems change of what that provider service would look like under the HCBS world. And so it really kind of positioned me to learn more about the systems of services statewide and not just kind of in my silo of my community. Um, and eventually I just kind of wanted to learn more about systems change and what that meant for families in particular, but also people receiving services and the providers that need to be able to provide the services. So when the time was right and Dolores was able to retire from the council, I was
Right.
able to apply and step in.
Okay.
Mhm.
Yeah. Then, so what different roles or things have you done with the DD Council? And maybe actually, because we have, our kind of our main audience for this podcast are different LIND students or leadership education and neurodevelopmental disabilities. Let's talk a little bit about what the DD network is and what the role of the Missouri Developmental Disability Council is.
Perfect. And you can support me in this, George, because I'm sure you've shared this story, well, this picture several times. So I think of the DD network as a three-legged stool. So there are three components to the DD network. There's the DD Council, there's the USAID, which UMKC IHD is the USAID, and then there's protection and advocacy. So in Missouri, that's called Missouri Protection and Advocacy. So I work with the Missouri Developmental Disabilities Council, and our charge is really about capacity building and systems change. So we use our federal funds to work with our governor-appointed council members that are self-advocates, family members, and a couple state agency representatives. We work with them to create projects that spend our federal funds, and those projects will help infuse systems change in Missouri. So that might be through training and education pieces, that might be, in new service delivery demonstration projects. It can be a lot of different priorities. And so the UMKC, George, you can talk probably more articulately about that than I can. But we partner with UMKC a lot on our projects because UMKC supports our training and education and outreach, especially with family members and self-advocates across the state.
Yeah, and I would just add that all of the USAIDs, which stands for University Center for Excellence in Developmental Disability, but the USAIDs and the DD councils and the PNAs all came into existence as a result of the DD Act. And so part of that act is that it requires us to work together and
Mhm.
kind of form this network that is hopefully able to serve the state in a
Right.
more comprehensive way.
Exactly. Yes. And so together, the three legs of our stool really hold us up to be leaders for the disability community in Missouri and making sure that people with disabilities and their family members have access to services and supports that they need.
Yeah. And so you mentioned, I mean, we call obviously it's DD Council, but who makes up the council? Like, what does that look like?
Yeah, that's a great question. So the DD Council is in statute. So it's in Missouri law. So we have about a third of our representation is self-advocates or leaders with lived experience. So those would be people with developmental disabilities, typically adult age, but we take young adults as well are able to contribute to the work of the council. We also have family members of people with developmental disabilities. So that could be mom or dad, or it could be a sibling or an aunt or uncle, as long as it's somebody that's really invested in the life of the person that their family member with. And then we have state agency representation. And so the state agencies that are represented are in the federal statute. So we have like DESE, Department of Education, we have Voc Rehab, vocational rehabilitation, we have Department of Mental Health, we have Medicaid, all those representatives on their council to help inform from the state agency lens. But the primary leader of the council members are the family members and the self-advocates working through the council to make that change.
One of the things, Emily, that you said in your bio was that your specialty is in listening and learning from family members and people with disabilities, and just um, I'd be interested to hear, because our primary audience are students about to enter our field, is sort of what have you picked up from being on the council, being a part of Easter, working for Easter Seals for so many years, even your time learning from the students you work with in New York, and what does it mean to like listen and learn from families, and what are some of those strategies that you've like learned over the years?
Yeah, so I'm a huge proponent of nothing about us without us, right? So I do not have any children or family members with developmental disabilities. While my daughter has a chronic illness, I wouldn't call it developmental disabilities. So I rely really heavily on family members and self-advocates who have given me their trust in this position to give me their experience so that I can represent that well when I'm at the table advocating for change, whether that's policy change or just systems change and how services are delivered or created, right? So it's really, really important to me as a professional to be surrounded by those champions, and I value above all else the lived experience to be the voice that leads us through change. So that's the number one priority that we put forth in the DD Council. So I mean, one of the things that I've learned a lot in the last couple years working with the DD Council is how hard that is, how hard it is for a self-advocate to sit at a table surrounded by all of these paid professionals that, you know, probably have college degrees and accolades and, you know, awards and all these other things, how hard it is to be that person with lived experience at those tables and being confident and kind of empowered to put your voice into the conversation and kind of shift the way that the conversation is going so that policies and systems are created to really represent the need of the people that are going to be using them.
How do you do that? What are some ways that you make sure those voices are primary?
Yeah. So how do I do that? Well, I've got to check my ego, right? So I really can't have a big ego going into those settings. I got to make sure that that I'm clearly focused on who needs to be the voice. And if that person isn't invited to the table, then I consider it my responsibility through the privilege that I have in this position to create a space for them, right? So even if that's me getting my foot in the door and then adding another chair to the table, that's what needs to happen. And then actually being able to work with those committees or boards or whatever that environment is to really support the message of the person with lived experience and what they're saying in those meetings, because you'll hear a lot from people with disabilities that, you know, just having an ally to support your message can really go a long way. So I don't want to duplicate anybody's voice or lived experience, but I do want to make sure that it's raised to the level of everybody else's in the room. And that can be a challenge sometimes, depending on the room that you're in.
I really like that idea, Emily, of like not wanting to duplicate, right? Because so many times I think that people's voices who are not often at the table are not given that space, like their stories can be co-opted by those of us with privilege who are in those spaces. And then so I just really appreciate that kind of stance of like, it starts first almost with that self-reflection of like, I recognize my privilege and I understand what that means, and then my responsibility to then make sure that those with lived experience are at the table and that I'm not telling their story as if it's my own. And so I think that's a really powerful message and important for those like coming into this field to recognize.
Exactly. And you rephrased it so well, Amelia. I mean, I really do feel a sense of privilege being in this role. I mean, I'm a college educated professional woman, right? And I know that gets me into places that some people that are using the system directly do not get invited. And so I do feel like it is my responsibility to make sure that those people are coming to be in the conversation, not just contribute, but to lead.
Mm-hmm. So for anyone who's never been to a council meeting, I guess first question is, can anyone come to a council meeting or?
Yes, they are public meetings because we're federally funded. They're public meetings. So open meetings is where you would find our meeting schedule and like how to contact us to get the Zoom link.
Yeah. Well, and I was just going to say, I always get so much out of those meetings, and because you have all of these members of your council with different experiences, and you're talking about things that are important to our state and just important in general. And so, given that, what are some things that you're hearing about, that are really important to people with lived experience in our state right now?
Mm-hmm. Yeah, so there's a lot going on in our state, so I'll try to narrow it down. So the
Yeah.
state currently has a Medicaid wait list, and that's because the budget that would have supported people getting on the Medicaid waiver did not make it through the full approval process. So we don't have the money in the state for new people that need a waiver service. So we will now have a wait list, and that's kind of a big deal because if people can't get services, then that creates a trickle down effect of instability in the family. You're having people that wouldn't have access to services that would start decreasing their skills, right? So you're talking about somebody that maybe was in a certain service before and now they can't, their skill set starts to decline because they don't have access to that anymore. You're talking about staffing with the direct support professionals and all of that. And self-directed services too is really important to the council. The other kind of big issue that we're working on right now is guardianship or alternatives to guardianship. So Missouri was, the Department of Justice gave Missouri a finding a couple months ago about being out of compliance with the Americans with Disabilities Act, the ADA, and that all has to be, that's connected with the use of guardianship, but also the use of institutionalized settings like nursing homes and how people with disabilities are disproportionately affected by those services or those systems. So, I mean, that's a huge topic for us. And we're also really striving to really build some capacity around interdependence and the family dynamic. So, as parents are aging and as their adult children are aging, but people are still living together, and you want people to be able to live together as long as they want to and stay happy and healthy in their homes without having to go into other settings. Really looking at that kind of aging piece tied with interdependence between the caregiver and the person with a disability. That's definitely of importance. And then probably the top point of emphasis and growth that we've had as a council in the last couple years is public policy advocacy. So we cannot lobby because we're federally funded, but we can tell policymakers how policy affects people with disabilities. And so sometimes that's disability specific policy, but a lot of times that's just broader policy in general, right? So it's really important for us as a council to make sure that policymakers have self-advocates and family members to go to better understand how their proposed legislation would affect people with disabilities. So that's definitely a focus of the council.
And you guys have a program, right, where individuals can, it's called Partners in Policymaking, where individuals can kind of learn the art of talking about policy and its impact. Is that right, Emily? Would you talk a little bit about that program?
Absolutely. So Missouri has for several years had an annual Partners in Policymaking class. And it starts in January and it ends in around September, and they go online. It's an online virtual course, and the class meets a couple times a month, usually in the evenings, sometimes on the weekend during the day. And every month they get subject matter experts. So we're talking about people that really know the nitty gritty of a topic like education or employment or home and community-based services. So you get those people that know the really detailed pieces of it. But we also have a lot of national speakers that come in to help share a little bit about what the vision is around those topics for people with disabilities. So it shares the vision of the future, but it also provides a lot of historical context. And the Partners in Policy Making class is for family members, and it's for self-advocates that are adults, and it's virtual. And if anybody that's interested in applying can apply before the end of October to get into the 2025 class.
Yeah. How do so if just thinking about maybe a specific topic, like you'd mentioned something I think a lot about, which is just alternatives to guardianship. So what is the DD, like what would the DD Council's role be in addressing that issue, as an example? Like what types of things do you all do?
So the DD Council works a lot as a DD network to address that issue. So we work a lot with UMKC, but we also work a lot with protection and advocacy. And we work through a working group called WINGS, MoWINGS, which is Missouri Working Interdisciplinary Network of Guardianship Stakeholders, which is a mouthful. Every state has a WINGS group. We have a MoWINGS group, which is the Missouri WINGS. And that's a multidisciplinary, meaning that a lot of different professionals and lived experience come to the same meeting to share their perspective on one topic. So we bring together some public administrators, we bring together state agency representatives, we bring together lawyers, we bring together self-advocates, and we all work on the same topic, which is guardianship reform in Missouri. So we do that work, but we also have some projects with, we have one project with Hume Resources, which is a grantee in the Kansas City area, and they're providing training and resources to the educational system on the topic of alternatives to guardianship, but they also are providing a consultation and mediation service for people that are trying to better understand what that decision means for them. So anybody that's thinking about guardianship or alternatives to guardianship, but they really need somebody to help kind of walk through the options. That's what that service is designed to do, to help people understand. And some people will choose guardianship because that's the best fit for them, but a lot of people will also identify where supported decision making could work and how they could make that work. And so they kind of map that process out.
And is that open to anyone kind of in the Kansas City area, or is that kind of a statewide service?
Yeah, it's statewide. And so they've got, I think, another year on the grant, and they're trying to make it a sustainable service through like a waiver kind of service in the future. So all of our projects have kind of a sustainability focus on them too. So it's not just a one and done, let's put this out there and everybody use it for the next 3 years, but it's let's put this out there, everybody use it, and then how are we going to keep it going in the future? Or at least the components that work really well, right? Because we learn through all of our project what works well and what doesn't work well, and we want to make sure that those things that are working are continuing to support people with disabilities in Missouri.
Yeah. Well, one of the things that I love about the DD Council and that you guys do so well is you bring people together to talk about or to brainstorm about a topic. And specifically, I'm thinking of like the transportation work group. I'm sure that's not the right name, but which I always get a lot out of listening to those. And
Yeah.
I know that in the past you've done you would have done things around emergency management and just all sorts of things. Tomorrow, in fact, we're all going to participate in a conversation about employment. And I just, I don't know, how do you guys choose what to build those conversations around, and then what all are you doing, I guess?
Yeah, I mean, that's a great question because there's so much to do, right? And we're a small team. We don't get a huge amount of funding from the feds, so we use what we get wisely to make sure that we're really focused. So the council gives us that direction ultimately. So, if they say transportation is a priority, then it's our job as staff of the council to make it happen. So transportation is a priority and guardianship is a priority too, which is why we have MoWings. We also have an Olmsted subcommittee right now that's going on because they really want to understand where the state is with our Olmsted plan. So our state does have an Olmsted plan, but it's kind of like a status check on, like, have we done what we said we were going to do? And if we did do what we said we were going to do, did it make a difference or not? Do we need to make any proposed changes to that? So it's really driven by our council members, which is why our composition is so important, right? Which is why the family members and self-advocates have to be leading that conversation, because they will set the priorities for us.
Mm-hmm. I forgot about the Olmsted group, but can you talk a little bit about that? And for those of us who might not know, what is the Olmsted decision?
Yeah, I'll try to summarize it succinctly.
I know that's a big question. I'm sorry.
That's okay. So the Olmsted decision was a Supreme Court ruling that basically means people with disabilities can't be discriminated against in how they receive services or kind of live their lives, right? So they can't be segregated, for example. The Olmsted decision really is a federal decision, right, that forces the states to understand how they're going to make sure people with disabilities are provided services in the most integrated setting possible, right? So the most typical way that we see the states doing that is through home and community-based services, or HCBS. And that's tied to Medicaid waiver funding. So basic HCBS says, if you receive Medicaid funding, then you can't do this, this, and this, which would isolate or segregate somebody with disabilities from somebody without disabilities. So the Olmsted decision is the overarching decision that really set the law that we can't discriminate against people with disabilities. And HCBS is kind of how the states are managing that from a Medicaid perspective. So the council, geez, I can't even remember how we got to the subcommittee. Honestly, I can't remember, but I think we were just interested. Every state has an Olmsted plan, right? And they're pretty robust plan. There's lots of steps to it because you're talking about housing, you're talking about employment, you're talking about day programs, you're talking about education, transportation. Like there's a lot to what integration really looks like. And so each state has a plan. And I think as we were working through the topic of what integration is for people with disabilities in Missouri, we got kind of curious about where we were as a state with our Olmsted plan. And so that created the Olmsted subcommittee, and they've been chipping away at the plan, for several months now. And so they're working, right, they were just working on the direct support professional crisis. That was part of, being able to have staff to do the work is important, whether that's provider staff or whether that's staff you can hire as somebody using self-directed services. And previously they also went through kind of the housing list under Olmsted. So they're kind of taking it topic by topic.
Mm-hmm. Yeah, and I'll just add how important I think that particular topic is, just because, and it's not just Missouri, but just generally our services and supports in the United States tend to lead to segregation for
Right.
people with developmental disabilities. So it's so important that we make sure that we are following the plan and meeting our plan. So Emily, if people want to learn more about the council or about you and all the really amazing work that you're doing, how can they find that out?
Yeah, so our most popular social media is Facebook, but we're also on Instagram, so you can find us on those two social media platforms. Our website is moddcouncil.org, and on our website you can get information on all the projects that we're funding right now and kind of who the grantees of those projects are, so you can connect with them if you have any of them are of interest to you. You can also sign up to get our kind of email blast. So we do like a monthly email letter, but then when the legislative session is going, we have advocacy blasts as well that will connect you with opportunities to testify or just connect with your policymaker in your area to share with them kind of your experience related to the policies that they're working on. So those are the best ways to get in touch with us. But of course, people are always able to, I think our contact information is on our website too, so you can reach out to staff directly that way.
Yeah, well, that's awesome. And I'll just say that, I know we have the council, but in terms of the council staff, you're a small but mighty group. And so thank you for all the great work you're doing. It really is amazing.
Yeah, I feel very, very blessed to be working with such amazing people, not as staff, but also as council members. I'm surrounded by some pretty awesome talent. So I do appreciate that with gratitude.
All right. Well, thank you, Emily.
Thank you, guys.
Thanks, Emily.